Hi, my name is Dr. Eliza Thomas. The most important update in health. Your doctor checks your fasting blood sugar every few months and hands you that small printout. You glance down, already bracing yourself, and there it is again. Higher than you hoped, maybe even higher than last time. So you try harder. You cut back on sugar, you skip desserts, you start reading labels. Maybe you even give up foods you enjoy. Some of you are already taking medication, doing exactly what your doctor recommended, and yet, despite all of that effort, that morning number, the one you see before you've eaten anything, just doesn't cooperate. In fact, for many people, it slowly keeps rising. That's frustrating. And for a lot of people, it's also confusing, because it makes you wonder, what am I missing? What if I told you there is something incredibly simple, something inexpensive, something already sitting in most kitchen cabinets that you can use every single morning before breakfast, and that multiple clinical trials have shown can significantly lower fasting blood sugar? Not a supplement, not a new prescription, not something complicated, a single small habit. Today, I'm going to walk you through exactly what it is, the science behind how it works inside your body, the precise way to use it correctly, and just as importantly, who should absolutely not use it, because this is not one size fits all, and you deserve a complete, honest picture before you try anything new. I'm Dr. Sarah Mitchell, and on this channel, I take the latest evidence-based medical research and break it down into clear, practical steps, especially for adults over 60 who want to stay healthy, independent, and in control of their bodies. If that sounds like something you value, go ahead and subscribe and tap the notification bell, because what we're covering here can genuinely change how you manage your health day to day. Now let's get into it, because what I'm about to share has completely changed how I approach blood sugar conversations with my own patients. The drink is simple: apple cider vinegar diluted in water, taken every morning before your first meal. And I know, some of you just rolled your eyes a little, because it sounds too simple, maybe even a little outdated, like something you'd hear from a home remedy book. But stay with me, because the science behind this is far more serious and far more convincing than most people realize. This is not just anecdotal advice. A 2025 meta-analysis published in Frontiers in Nutrition looked at 7 controlled clinical trials, including a total of 463 participants with type 2 diabetes, and the results were not subtle. Participants who used apple cider vinegar consistently experienced an average drop in fasting blood sugar of nearly 22 mg per deciliter. That is a real, measurable, clinically meaningful reduction. Even more interesting, their HbA1c, which reflects your average blood sugar over 3 months, dropped by about 1.5 percentage points. Now let me put that into perspective for you. A 1-point drop in HbA1c is often enough to move someone out of the diabetic range into pre-diabetes. A drop of 1.5 points is significant enough that many physicians would consider it a major improvement in overall metabolic control. And this wasn't just one small study. This was a structured analysis of multiple independent trials evaluated using the GRADE system, the same system medical professionals rely on to assess how strong and reliable clinical evidence actually is. So the question becomes, how? How does something as simple as vinegar have that kind of effect inside the human body? Let's break it down in a way that actually makes sense. When you eat carbohydrates, things like bread, rice, potatoes, even fruit, your digestive system breaks them down into glucose. That glucose enters your bloodstream, and your blood sugar rises. Your pancreas responds by releasing insulin. Insulin acts like a key, unlocking your cells so glucose can move from your bloodstream into your muscles and tissues where it's used for energy. But in type 2 diabetes, or even pre-diabetes, that system doesn't work properly. The locks on your cells become stiff. This is what we call insulin resistance. Your body produces insulin, sometimes even more than normal, but the glucose doesn't move efficiently into the cells, so it stays in your bloodstream. And over time, that elevated blood sugar begins to damage blood vessels, nerves, kidneys, eyes, and the heart, often silently, over many years. Now here's where apple cider vinegar comes in. Its main active component is something called acetic acid. And acetic acid affects your body in several important ways at the same time. First, it slows down specific digestive enzymes responsible for breaking down carbohydrates into glucose. Think of those enzymes like workers on an assembly line, rapidly converting food into sugar. Acetic acid essentially tells some of those workers to slow down. So instead of a large spike of glucose hitting your bloodstream all at once, the sugar is released more gradually. That gives your body time to respond more effectively without overwhelming your system. Second, acetic acid appears to improve insulin sensitivity. In simple terms, it helps those locks on your cells become easier to open again. So even with the same amount of insulin, your body is better able to move glucose out of your bloodstream and into your cells. That's not just managing symptoms, that's actually addressing one of the root problems of type 2 diabetes. And third, and this is especially important for morning readings, it may reduce the amount of glucose your liver releases overnight. Your liver acts like a storage center for glucose. While you sleep, it releases small amounts of sugar into your bloodstream to keep your energy stable. But in people with insulin resistance, the liver often releases too much. That's why many people wake up with elevated blood sugar, even though they haven't eaten anything. This is known as excessive hepatic glucose production. Acetic acid appears to signal the liver to slow that release down. And the result? Lower fasting blood sugar in the morning. Now let me ask you something. What is your typical fasting blood sugar when you wake up? Drop that number in the comments if you're comfortable. It helps build awareness, not just for you, but for others going through the same thing, because many people feel like they're the only ones struggling with this, and they're not. Now we also need to talk about something called the dawn phenomenon. This surprises a lot of people. Between about 3 a.m. and 8 a.m., your body naturally releases hormones like cortisol, growth hormone, and adrenaline. These hormones are there to wake you up and prepare your body for the day. Part of that process includes telling your liver to release glucose into your bloodstream. In a healthy system, insulin balances that out. But if you have insulin resistance, your body can't keep up, and your blood sugar rises, so you wake up with a high number, even if you ate perfectly the day before. That's why timing matters so much with this approach. Taking apple cider vinegar first thing in the morning on an empty stomach may help reduce that early glucose release and prepare your body to handle breakfast more effectively. Now, let me share a real example. A patient of mine, Margaret, 71 years old, came in feeling frustrated and discouraged. Her fasting blood sugar had been stuck between 145 and 165 for over 2 years. She was already on medication. She had cleaned up her diet, but nothing seemed to move the needle. We decided to try a structured approach. She started taking diluted apple cider vinegar every morning, added a short walk after dinner, and made a small reduction in evening carbohydrates. She stayed consistent for 12 weeks. At her next appointment, her fasting blood sugar had dropped to 118. Her HbA1c improved significantly, and her physician decided not to add another medication. Now, I want to be very clear, that result didn't come from vinegar alone. It came from consistency, small lifestyle changes, and using a tool that actually has biological support behind it. There's also evidence suggesting improvements in cholesterol levels, particularly LDL cholesterol, which is closely tied to heart disease risk. And that matters because diabetes and cardiovascular disease often go hand in hand. But we also need to be honest about the limitations. Most of the studies were relatively short, between 4 and 12 weeks, and involved a few hundred participants. So while the results are promising, they're not absolute. This is a supportive tool, not a cure, and it's not safe for everyone. If you have conditions like gastroparesis, kidney disease, acid reflux, ulcers, or if you're taking medications like insulin or diuretics, you need to speak with your doctor first, because in those situations, this approach could do more harm than good if not monitored properly. Now, if you are a good candidate, here's how to use it safely and effectively. Choose raw, unfiltered apple cider vinegar that contains the mother. Start with 1 tablespoon. Always dilute it in a full glass of water. Never drink it straight. Take it 15 to 30 minutes before breakfast. Use a straw if possible and rinse your mouth afterward to protect your teeth. Track your blood sugar daily and look for trends over 8 to 12 weeks. Don't expect overnight results. Think in terms of gradual improvement. Consistency is what creates change here. The bottom line is this: a simple, low-cost daily habit, apple cider vinegar and water, has been shown in multiple clinical studies to reduce fasting blood sugar and improve long-term glucose control. It works through real mechanisms in your body, and it may even provide additional heart health benefits. But it must be used correctly, consistently, and with awareness of your personal health situation. Now I want to hear from you. Comment "trying" if you're going to commit to this for the next 8 weeks. Share your fasting number if you're comfortable. Or send this to someone who's struggling with their blood sugar, because small, simple information like this can make a real difference. And if you found this helpful, subscribe and turn on notifications. Next, I'm going to show you one breakfast food that many seniors believe is healthy, but research shows it may actually raise your morning blood sugar. It's probably in your kitchen right now. I'm Dr. Eliza Thomas. Take care of yourself, and I'll see you in the next one.